Hey folks, welcome back to another module. We are now on module number 6. If you can believe it, we're just plowing right through the semester. I can't believe that we're more than halfway through. It's a good place to be as we get closer towards the end. And we're going to shift our focus today and to talk tonight, today, whatever time it is for you, wherever you might be, to markets and products. And so as we're continue just our discussion on marketing, we're going to be looking at markets specifically. How do you segment them? How do you understand what's going on within the markets? And then we'll also talk about products and some consumer behavior and some of the habits and decision making around consumers. But first, let's talk about markets and sort of the nature of healthcare markets. And I want to make sure that to remind you that the readings are absolutely important, and also the review of the PowerPoint slides will help supplement that. And then there are some excellent scan materials available for you under the scan section in the module. So please do pay attention to those areas, dig into them, and I think it'll help broaden your understanding of the content. And so here we're looking at how do you understand markets? And market does mean different things to different people, different organizations. It usually means a geographical service area serviced by a healthcare organization, but it can mean other things too. And so you really want to make sure that you understand what it is from a market perspective that you're focusing on when you're describing and identifying your markets. And those markets can be described or delineated by a variety of different ways. It can be based on geography. Is it a zip code? Is it a city? Is it a county? Is it a population segment? Is it everyone over 65 or all pregnant moms, or is it just children? What's the consumer demand within a particular market? Is there a high demand for one kind of service over another? You might be in a particular geographical area where there's a lot of young couples that are newlyweds, newly married couples, and so they've got small kids. And so there's a number of different considerations when you're describing the market that your focus is on. Or it could be a new market. It can be a market that maybe you're currently not servicing. And you may be servicing one zip code in a Medicare Advantage program and decide you're going to expand to an additional zip code or geographical area. And then the last real key area around delineating or describing markets is what is labeled in the textbook as market without walls, but really what that refers to is really the web and how the world opens up to really just a huge market. When you think about everyone who has access to the internet and everyone that you as a provider or as a organization have in terms of the size of a market that's on the World Wide Web. And so when you think about your market and you're describing it, you're delineating the market, you also want to think about the distribution of patients. You want to think about what kind of patients are within a region for a healthcare organization. What's the distance in the driving time from one location to the next within that market? You know, there's studies that say that some patients will not go to a hospital if it's more than 5 miles away. And so you have to be thinking about as you describe and delineate your market. Also, what's the distance variables or components, and then what's the anticipated demand? How much demand will there be within a particular market? And so that really takes us into this whole marketing profile process, where after you've looked at the boundaries and you've done some delineation, you want to look at what's the composition, what's the size, what types of individuals live within that market, what's their health status, what are the health services demand, and then what's the availability of resources that may be competing against the services that you're wanting to provide. And so all these things are key when you're delineating and identifying your market within a particular area or for a particular organization. And so you also want to take into consideration things like what's the consumer willingness to engage with the organization? What's the payer mix? Is it private insurance? Is it Medicaid? Is it Medicare? What other healthcare systems are within a particular market, or what other health insurance carriers are in a particular market, or whatever type of healthcare organization you're a part of? And what's the demand? What's the perceived need? What is the perceived demand that will be in a particular market? And it's always important as you're thinking about markets and studying them to really understand that markets change. And some of the reasons that they change is that demographics can shift. You can have an area that's the age is changing, where you may have had young families at one time and now they're aging and they've stayed in that market and now they're moving out, and maybe new young families are coming in. And then also changes within consumer attitudes or preferences, how consumers may want to access the healthcare system. And then, of course, there's always the competitive situation around markets changing. And so that's an overview of some of the highlights around healthcare markets. When you begin to shift gears and look at consumers and consumer behaviors, remember that in healthcare, a consumer is anyone who has a potential to use a healthcare service. So technically, everyone is a consumer of healthcare services because everybody's going to need to get to a doctor at some point. And so when you think about the size of the market and around what the consumer base is within healthcare, it's huge. It's gigantic, larger than any other industry, perhaps outside of food distribution. And so consumers within healthcare it's a huge base, it's a huge market. And really, it's only recently, as we talked about in our last module about the evolution of marketing within healthcare, that healthcare organizations really began to look at the whole idea around consumers. Historically, it's been a focus on patients, people that are sick, that are needy, and now that has completely turned upside down to where people that healthcare organizations engage with are consumers. They're healthy, they're ill, they're in varying stages along the health continuum, needing services, and consumers are the focus now of really all marketing efforts. What consumers want, what they perceive, what they need, and so there's a huge emphasis on the consumer within healthcare that didn't exist even as much as maybe 20 years ago. And so healthcare consumers, though, are similar to other industry consumers, but they're also different. And we talked about what makes healthcare organizations different in the last module, and why there's different practices and sort of a different evolution of healthcare marketing and the ways that we interact with consumers, and that all makes sense when you think about it from a historical perspective. And when you think about the focus on consumers now being the trend across all industries, and when you think about why they're similar, really, healthcare consumers are similar to other industries because a lot of the consumers and a lot of really customers in general are affected by financial decision making. So in that way, healthcare consumers are similar to other consumers in other industries, but healthcare consumers are always also very different. And we touched on some of the reasons in the last module, where purchase decisions oftentimes, the financial transitions for healthcare services are often not made by the person who's going to be using them. They're oftentimes the consumers are unaware of the price. There's a limited availability to try something out. When I buy something online from Amazon and I have it shipped, I look at it, I touch it, I taste it, I smell it, and if I don't like it, I send it back. It's a little bit hard to do when you're buying a healthcare product or service. And it's interesting with the healthcare purchases that the services are often purchased with an emotional component that's very different than other types of services or goods in different industries. And when you think about an individual that's faced with a chronic illness or a terminal illness or an emergency that requires medical intervention, those are highly emotional encounters. And so that purchasing process is very different than it is within other industries. And so it's critical to understand consumers. And when you think about consumers, you also, as we get back to our whole market comments earlier about the consumers within a market, you really want to begin to think about how do you segment consumers within a market, and what are some of the ways or the components of segmenting consumers within a particular market. Again, there's a demographic segmentation based on demographic variables of an individual. There's those, again, those geographic segmentation variables. There's the psychological makeup of individuals and their health risk scores. And so as you begin to segment a market, you're going to be wanting to think about that. What's the usage patterns, the frequency of emergency room utilization, or their payer type, as mentioned earlier, whether they're Medicaid or whether they're Medicare or if they're private pay. And then even taking that a step deeper in terms of segmentation and looking at their benefit structures and see, are certain things covered or are they not covered, because that's going to have an impact on what services individuals will be purchasing. And so it's also important to understand within your market as you're segmenting consumers, also to really understand what are the types of consumers that you have within the market. And when we think about the types of consumers, we're referring to what kinds of patients are going to be within your marketplace. Do you have a heavy population of certain disease conditions or certain predispositions to certain illnesses within a geographical area? Because all of that is all able to be identified through data. And then you want to think about, from a consumer perspective, who accesses and consumes the information or the services that you're providing as a physician, as a clinician, sort of the type of consumers that you have, not only based on maybe a consumer's medical condition, but also based on what is their role. Are they a physician? Are they a patient? Are they a member in a health plan? What is the type of consumer within the market? In terms of understanding consumers, it's really important as you segment and identify the consumers within a market that you understand also the steps that take place within the decision-making process of a consumer. And there's a number of steps. They're outlined nicely in the text. There's the first step, which is really identifying a problem that a patient may have. They begin to search, to look for research on the web. They become aware of what the services or the goods are that they'll need to purchase. They begin to understand about those goods and services. They look for alternatives to what they're going to purchase to see maybe if the price is better or if they can get a higher quality product. They're going to begin to look to see if their insurance covers it. They're going to begin to look at their contract, their benefits, and then they're going to identify who is it that they would like to be providing them that service. And then they make the decision, they pull the trigger. And then once the purchase is made, they engage with the product or the service, and then the final stage is that post-purchase behavior. And do they have buyer's remorse, or do they feel good about the services that they purchased? And so those are the steps that are critical within consumer decision making. And it's important to understand those different steps. And really that ties back to our whole health value chain, which we looked at in the strategic planning process, where you want to identify what are the pre-purchase or the pre-sale or pre-service components to a consumer experience. What are they for directly at the time of the experience, and what are they after the service is delivered? And so you can begin to see some of the alignment between what we talked about in strategic planning and then what we're talking about within the marketing. I want to take a pause and just make a few comments about international markets. And I think this is important, just if not for at least good cocktail party conversation, but really to understand the trends within the international market, healthcare marketplace. And there is a web resource under the SCAN section that details out the international healthcare, the global healthcare situation by Deloitte. It's an excellent resource. Please take a minute to look at that if you can. But trends in international healthcare, things are expanding. American health systems are seeing more international patients. International systems are seeing more international patients within their organizations. And there's an increased focus on international marketing for U.S. healthcare services out in other countries. A number of factors really are contributing to the growth. Healthcare. The world is getting healthier. The world is really, healthcare infrastructure is improving. And so that is causing the water line to rise. Some of the medical costs in some of the systems in the country are prohibitive to people, and people are finding it's cheaper to go outside of the borders of their country into an international uh, uh, delivery channel, and to find a country that's delivering the service and perhaps a cheaper and even higher quality um, rate than what they might get in their own home state or home country. There's positive patient experiences. People report about the concierge experience of a foreign healthcare experience. People flying down to Mexico to have surgery, and they say it was absolutely fabulous. When you think of the price of a hospital room per day here in the States, what kind of care can you get for that same amount in another country? And so the medical travel industry is growing. Trends are increasing. And the other piece, I guess, which is a benefit, is that when you have a procedure done internationally, you get an international travel trip. And so you're able to travel into another part of the world, which is attractive to many individuals. But folks definitely report excellent care overseas. The physicians are excellent. Word of mouth is really what's causing the international travel boom, or physicians are also recommending that these services be performed outside of the boundaries of a particular country. The next chapter in the text is the understanding healthcare products, and really understanding the product mix and making sure that once you've identified your market, you understand all the consumer variables, that you also really also understand your products, and being able to understand, are they a good versus a service? Are they is it who's buying it? Is it a consumer that's buying it? Is it a company that's buying it? Are the goods durable or non-durable? Is there time-sensitive components to think about with marketing products in terms of their shelf life? And then the other piece is that how do you market a product versus a service line? And focusing on one individual offering versus an entire line of service. And so that makes you think about the products that you have on your shelves that you offer to your consumers from a product lifecycle perspective. And there's 4 different areas that are focused on within the text around the product life cycle. So make sure you expose yourself to those around from the time a product's introduced until the product has lived its shelf life and is beginning to need to be refreshed, where there's lots of competitors who are providing the service and it needs to be given a new facelift. And so the last chapter is really reflecting the topic of service utilization, and really trying to help us as we build our marketing plans and our strategies to understand, what's the utilization of health services within a market? What's the real demand? What influences demand? How do you measure the demand? And how do you predict it so that you can manage from an implementation perspective? And so it's very important that understanding healthcare utilization, that you define demand. And healthcare needs are one way. You want to look at needs, you want to look at wants, you want to look at the standards of care, and you also want to look at utilization, the amounts of services that are consumed. And so when you think about the needs of the market or the consumer, what are the conditions that are going to require care? How many members or how many patients are there within a market that are sick? And what does the market actually want? Do they actually want the services that you're offering? And what are the services that are provided? Are they meeting the standards of care for particular conditions that are needed by a particular market? And then how much of the services are actually consumed? Being able to look at data to see what is the real utilization of services so that you can predict needs for the market that you've identified by the consumers within that particular market. There's another tool that is in the scans section. It's the resource called the Dartmouth Atlas. I'm going to really encourage you to look at that. And it's interesting to see how different geographical areas have very different utilization patterns around certain conditions, certain procedures, certain services based on the demographics of the population, without having different health outcomes. That's really the fundamental primary foundation of the Dartmouth Atlas. So look at that, review it. The work that Jack Wenberg has done at Dartmouth, excellent information, good to understand, at least from a high level, that kind of information really is out there and is important, that there are variations and there are factors that influence demand. And really, they could be psychological factors, they could be demographic factors, they could be lifestyle factors. And so those things are all absolutely critical. And so when you're looking at demand, you're going to want to also be able to measure and understand based on data. And so you're going to be wanting to look at facility information, you're going to be wanting to look at utilization reports, you're going to be wanting to look at numbers of FTEs that are impacted by conditions or situations within an employer population. All the factors you're going to want to take and understand from a utilization perspective to see what's really happening. And then you lastly want to be able to predict health services demand. And of course, you can look at utilization data and predict generally based on season, based on time of the year, based on historical data. You can look at population-based models to see what potential trends there will be in certain markets by certain consumers. And so those are the highlights of the module. I want to encourage you again to just review the materials, read the chapters outlined in the book. There's a couple of assignments. There's a discussion board and a written assignment, and some interesting scan materials. And I hope that these tools expand your knowledge of both markets and consumers.